So are you a smoker? My arch nemesis, period. If you ask me, what is my arch nemesis? Who is my problem patient? It's my smoker, there's no question. What we've known about smoking since the 50s is that it's a vasoconstrictor. We actually known it since the 40s. Vasoconstriction means that capillaries are constrict. Well, if blood vessels is what bring me my antibodies, my building blocks, everything, nutrition, everything I need to mend a wound, it's restricted from the beginning. It is a reversible entity. It takes about 46 weeks to reverse the effects of smoking on wound healing, minimum 46 weeks. But most people have what we call comorbidities. That means multiple problems, not just smoking. They have diabetes. Okay, you have diabetes, which is the exact same problem. It's a disease of the capillaries for the most part. Most people don't realize, they think it's about blood sugar. It is, but what is sugar? It's an acid. What do acids do? They kill things, essentially. Capillaries are very fragile, and you get a very acidic environment. It causes the capillaries to die off. And so a typical nerve is saran wrapped by capillaries. So what happens to the nerve? The nerve gets fried, gets irritated, and that's where they have neuropathies and all these other things peripherally. But it still affects the mouth, even though we have a very rich environment. It'll affect the eyes and the mouth and obviously the extremities. But that vasoconstriction means they're not going to mend the wound very quickly and easily. It's very delayed healing. Can you mend a wound? Can you heal? That's what I want to know the most. Because that's not the end all. You got to know more than just that. But patients are real. They'll tell you, man, I cut myself. It takes me forever to heal. Guess what? We may have problems with that implant. I tell them straight up. I said, we may have issues. We'll go slow and see how you do. There's ways around it.
Is it worth it to lie about your medical history to get implants?
It's never okay to lie ever under any circumstance when it comes to medical issues. There's no reason to do it because you're just hurting yourself. Because there's ways to get around the inhibitions or the the factors that we have issues with. We'll over-treatment plan or we'll under-treatment plan. I mean, we'll go slow. There's all kinds of things we can do to get around if I know about them. If I don't know ahead of time, I can't give you the best options.
Do people lie anyway?
Oh, yes.
Why?
Part of it's ignorance. They just don't know any better, or they forget about things. Medications are so complicated, they don't even realize a lot of times what they're taking. Most patients, I'd say 80+%, don't know what they're actually really taking the medication for, or don't understand what it's doing to them, what's it doing for them.
If you smoke, that undoes a lot of work.
It does, and just being truthful, it's not as damaging as if once they heal, they're actually will be okay. I'm not encouraging them to pick up smoking again, but it's the healing phase of it that inhibits the most. You're not going to get it back. If you don't lay down bone from the beginning, it's not going to come back in around later and then attach to your implant. It's not going to happen.
Okay.
So it's really a lot of dentists, a lot of surgeons don't even truly understand that the very beginning phases of the healing process are very intricate because the first hours are the most critical part of the entire process.
The first hours?
Hours. So what's happening, if you don't bleed, you can't mend a wound, okay? If once you cut a capillary or tissue, there's a whole process, a whole cascade of events that are occurring, okay? Laying down a boatload of different chemicals to help stimulate what we call angiogenesis, which is the beginning phases of growth of capillaries. It stimulates that. So if you have anything that inhibits that process, that's critical because the faster you build the bridge across there, which initially, if I have a wound, we'll talk about extraction socket. If I have an extraction, take the tooth out, fills in with blood almost immediately. Some people don't always bleed. You'd be surprised we get into cases they're not bleeding hardly at all. That's not good. We actually stimulate bleeding a lot of times in those cases. We need it to form a blood clot. There's what we call primary and secondary wound healing, okay? Primary means we have primary closure. It means we're closing the wound up tight from the beginning. A secondary wound healing would mean take the tooth out, don't close it at all. We're trying to get that blood clot in there. That blood clot acts as a scaffolding for everything to build into it. So if I get my capillaries growing in through and burrow holes into that clot, then they're laying down tracks, right? Now they can bring in what they call osteoid. Osteoid would be the beginning phase of bone. It's very liquid at first, and it becomes solidified later. And it takes a little bit of time to do it. Everything inhibits what I just said. That osteoid production is the most critical part of an implant. If you don't get that production quick and seal up those porosity, the holes that are in the implant, the faster you heal those, get into those holes, the more holes you get that osteoid into, the better the integration. Because a lot of people think that it's actually the threads that keep the implant in there long term. It's not the threads. The threads actually on the implant are what we call primary stability. That's primary stability means the initial torque value I put in that implant, meaning I have a very specific torque I'm trying to hit. If I can't hit that torque value, the implant's not supposed to be used or loaded or needs to be removed. But say that I hit my torque values. At that point, the threads are going this direction the entire time. They're getting weak by the day. Week 4 through 6 is the weakest point. Because at that point, osteoid, which is the new bone formation, is going like that. And that weakening of the threads is coming like that. So there's an X. In the middle of that X is the 4th through the 6th week, which is the weakest point in implants, period.